I am very proud tonight to be able to have before us a very personal friend, Walter Graham from UNOS. He's the Executive Director, CEO of the UNOS Foundation, has served as UNOS Executive Director since 1995. As the Chief Staff Officer, he's responsible for overseeing all corporate and operational matters. He has responsibility for the work of all the staff of the organization and interacts directly with the UNOS Board of Directors and officers. Graham's also the President and CEO of UNOS' two subsidiary organizations, the UNOS Foundation. He served as UNOS Assistant Executive Director for 8 years before taking on the role of Executive Director in 1995 and was a management consultant to UNOS for 1 year prior to joining the organization. As an attorney, he worked more than 35 years of senior management experience in both healthcare administration and served as senior corporate executive at 5 different healthcare organizations. Graham received a BA in political science from Arkansas State University and a JD from the University of Arkansas. More than that, he's a longtime personal friend. I've worked on committees with UNOS and now the board for these past 10 years. He's been and continues to be a strong supporter of the work we do as a And with that, Walter, please come share with us your thoughts. Thank you.
Well, good evening. Let me say, to begin with, those of you in the back, if I don't speak loudly enough, please give me a signal. My wife tells me I mutter, mumble. I don't know my husband hears that sort of thing, but if I do, let me know. I want to say thank you for letting me address you tonight on this very important occasion, the 25th anniversary of your organization. From its inception, TRIO has been one of the most consistent and effective voices for transplantation for the transplant recipient. TRIO members have a lengthy and valued presence on the UNOS Board of Directors and over home committees over the years. We're honored, of course, to have the current president, Jim, serve on our board for the next 3 years, and perhaps he may get elected to another term for even longer. Just out of curiosity, I'd like to know how many recipients are there who've had a transplant for, say, 20 or more years? That's pretty awesome. That's pretty awesome. Congratulations. I think that's an indication of just how wonderful this procedure is and how life-changing it can be. In just a few days, UNOS is going to mark the 25th anniversary of serving as the National Organ Procurement and Transplantation Network, or NOPN, under federal contracts. Such anniversaries as your 25th and our 25th give us an opportunity to think back over what we've seen during that time and where we are today and looking ahead into the future. Now, those of you who began your transplant experience, let's say 20 or more years ago, will remember that things were much different then than they are now. Cyclosporin had just begun to be used on a regular basis, and other immunosuppressant drugs were still in development. The field was rapidly growing. Many new transplant surgeons and physicians, many of whom have been trained here under Dr. Starzl, were going out and starting new programs around the country. Many more patients are being added to the transplant list, many more transplants are being performed than ever before. So suddenly there was this burst, boom of demand and need for transplants, and the supply did not keep up with the demand. Survival rates were on the increase, but people didn't know how that would be into the future. There was a lot of uncertainty. And so in this environment, one of great promise, but also one of great change and uncertainty, the Congress of the United States established the National Organ Transplant Network through the National Organ Transplant Act, I should say. Now that act called for the establishment of the network. It was a unique challenge for us to develop a system that would coordinate the efforts of donation and transplantation professionals nationwide. Now, you may have seen some of those ads on TV for, say, vitamins or a diet plan, and they say something like, 4 out of 5 doctors agree that you should buy our product. Well, if your experience has been as mine has been in my time at UNOS, getting even 2 doctors to agree on something policy would be a real challenge. So I often wonder about those ads. But the reason that it's difficult sometimes to get those together, especially back in those times, is that the transplant doctors and surgeons in particular had been such staunch advocates for their patients. And what this new network called for was a cooperation, a coming together, so that there would be a sharing of organs, a sharing of ideas, an interchange, an interdependence, and cooperation that's unlike anything in any other field of medicine. And so that was the challenge for us to develop a system that would be of benefit for all candidates and all recipients throughout the country. When UNOS began developing the OPTN, its role was largely to build. There was no model anywhere in the world, really, that we could follow that would be on the kind of scale that the OPTN had to achieve. One that began with about 200 transplant hospitals in the country, 60 organ procurement organizations, and at that time, 13,000 candidates on the national waiting list. So we worked very hard in those early years to establish a transparent, inclusive, and census-based policy development process. The challenge of deciding who gets these organs when there's a supply and demand imbalance is a very challenging, very difficult question to ask and answer. And so how do we do that in a way that will draw people together? Highly secure, computer-based matching program to place organ offers so that organs were placed efficiently and effectively and not wasted. A comprehensive clinical database to support key advances in the science of transplantation. Well, the key to much of our progress during that time was and remains a very inclusive, consensus-building process. Organ transplantation requires an extraordinary level of collaboration and cooperation to be successful. Hence the name of my organization, United Network for Organ Sharing. Sharing is such an important part of this. Of course, transplantation depends entirely on the selfless generosity of those who help save lives through organ donation. That precious human gift must be carefully recovered and preserved before it's transplanted. Transplant candidates are actively screened and monitored before transplant. And they're subject to many lab tests, as you know. And recipients are actively followed to monitor and maintain their health following a transplant. There's no way that a system, a national system like this, can be developed or managed without the involvement of the people who do this work for a living and those who have lived it in their personal lives. Now, compared to most organizations, the UNOS Board of Directors is enormous. There are 42 members of our Board of Directors. It's that big, though, because we need to ensure that the key professions are represented. It is that board that establishes the policies for how organs are allocated. There is significant representation from people who have personal experience with donation and transplantation, recipients, donor family members, living donors, family members of recipients. Often those representatives have multiple perspectives to bring to the table. Jim, of course, is a heart transplant recipient, but his wife is the mother of an organ donor. Fully 1/3 of the UNOS Board of Directors are members, are people who have these personal experiences, and we draw upon them to guide our organization's efforts. UNOS also has more than 20 national advisory committees that develop detailed proposals that come to the board that ultimately become policy. Every one of those is an important committee, but one of the most prominent ones is the Patient Affairs Committee. Nearly every member of that important committee is a transplant recipient or a recipient family member, and there are some donor family members as well. We've been honored over many years to have had many people with TRIO affiliations involved on that committee and on other committees within UNOS. You know, it's rather unique in medical policy making to have a stakeholder committee of people who ultimately benefit from these policies to be helping develop those policies. But it's vital for us to have that perspective. We must make sure that our activities are grounded in service to those who have received transplants and to those who still need them. The system we've developed as a community and through consensus has accomplished a great deal. Over the past 25 years, nearly 550,000 transplants have been performed in the United States. Of those, more than 400,000 were made possible through deceased donation. Now, I'd like to take a moment and reflect on the numbers. There are more than half a million organ transplant operations in the last 25 years. And of those, we estimate more than 300,000 recipients are living today, of whom nearly 280,000 continue to have a functional transplant. And surrounding every one of those individuals is a community of loved ones, friends, acquaintances, who all have gained from this transplant experience because of the one who received the transplant leaving their loved one. It's no stretch to say that the gift of life has personally touched millions of Americans over the last 25 years. As much as organ transplantation has moved so many lives, many more people remain in need. The current need for transplantation is greater than it has ever been. As I said a moment ago, when we first began our work, there were 13,000 people on the transplant waiting list. Today, that number is over 115,000. The demand for kidney transplantation in particular continues to grow. More than 90,000 men, women, and children are on the list waiting for kidney transplants, and fully 500,000 people in this country are on kidney dialysis. So, despite the best efforts of every organization in the field, the supply has just not met the demand. That's why the waiting list continues to grow. Over time, the mandate for UNOS and the OPTN has also grown as the waiting list has grown. For many years, UNOS's primary responsibility was to allocate organs from deceased donors and to try to maintain transplant data. But in recent times, there have been significant new responsibilities asked of us by the federal government. And these include reviewing transplant institutions to ensure that they follow policies and maintain a safe and healthy environment for patients, helping ensure the health and safety of living donors, which is something new that was added just within the last few years, developing processes and standards to make sure that organs are used efficiently and effectively. All of these are vital responsibilities, and we take them very seriously. But with these new expectations added onto what we do, nothing else has gone away. And like any other organization these days, UNOS does not have excess funds or excess manpower to easily draw on to manage these things. And we believe the new mandates, that even more new mandates and new responsibilities will be coming along very soon. One of the things we're anticipating is having the OPTN take jurisdiction over face and limb transplants. We think that's coming within a very short near future. So how do we best manage today's challenges and position? How can we position us for the future? We have discussed that internally a great deal over the last year. Earlier this year, our board of directors adopted a strategic plan to help us build for the future. And there are two plans that I want to talk about. Jim asked me to address the plans some tonight. There is a strategic plan for UNOS as a corporation. And we defined in that three primary roles for our company. The first is to be the OPTN contractor, and that's why UNOS was formed in the first place back in 1984. And that's our principal goal still today. But there are two other primary purposes to support that first one, and those are to continue to focus as a member services organization and to be a world leader in services provided that support organ transplantation. Now, these three roles are mutually supportive. To have the resources we need to meet the responsibilities we have as the OPTN, we must pursue other related areas. UNOS needs the involvement and the participation of the transplant community to be an effective manager of the OPTN. It requires networks of experience and knowledge to be a model for the development of transplant networks around the world. In the past, we provided guidance to Japan, as well as South Korea, as they build organ transplant transplant systems. More recently, we've met with transplant professionals from Canada and Qatar to help them develop transplant services nationwide. UNOS's work as the OPTN contractor is what most people probably think about when they think about UNOS. And it accounts for most of what we do. But it's important to understand that the funding for the contract we have with the federal government is very limited. Very little of the funding for the OPTN comes directly from the federal government. Only about 10% of it comes from the feds. The rest has to come from private funds that UNOS is able to generate. And so that revenue doesn't cover all the expenses that we need to operate the network. Okay, I'm not talking loudly now. UNOS must have resources not only available through the contract itself, but also to help us build the contract, the things that are not reimbursed under that contract. So we also need to have the organizational capacity to serve recipients and transplant professionals beyond the scope of the contract. Now, as part of our corporate strategic plan, we're focusing more of the attention of the board of directors on building organizational capabilities. One thing we've done is form 3 subcommittees of our board of directors with input from outside subject matters to bring focus on UNOS's corporate needs. Jim Gleason is a member of one of those subcommittees, which is advising us on information technology needs. We're also focusing on corporate financing and long-range planning for non-contract activities. We also developed a strategic plan then for the OPTN. Now that plan is a guide for how UNOS can prioritize policies and standards to improve the network overall. I won't go into great detail about that plan, and I encourage you to look on our website if you'd like to read it, because it's quite extensive. But first and foremost, and this is literally our first goal, we seek to increase the number of transplants being performed. This includes increasing the number of organs transplanted from donors, as well as supporting ethical and effective ways of increasing donation. I'm excited to tell you that our work on a very large and comprehensive deceased donor potential study is coming to a conclusion, and the findings of this study will help transplant professionals identify more ways to increase organ availability for transplantation. We also want to increase access for transplants, to reduce differences in local waiting times, and make sure everyone who may benefit from a transplant gets supportive information about the option for transplantation. We seek to improve survival for patients, and this includes potential changes to organ allocation to maximize long-term survival, and partnering with other organizations to develop educational materials. We will promote transplant patient safety. Thank you. So I hope you see the emphasis in all of these goals. They focus our attention where it must be, and that is on those we serve. We do everything within our capability to help as many people as possible who have end-stage organ failure. And we do so in a way that provides all recipients the best possible outcome in the safest environment. In keeping with a number of our strategic goals, we just announced a significant policy proposal for public comment. The current system for allocating deceased donor kidneys has helped many people over time, probably many of you in this room. We've studied a number of ways to improve it. And I should probably mention that back in 1987, when the network actually began operations, it was Dr. Starzl who had the idea for the original kidney allocation plan. So here it is. It's interesting to be here tonight with him, and that we're announcing a proposed new policy when 25 years ago he was the one who helped get all of this started. You may have already heard about one feature of the proposed policy, which is to assess how long a donated kidney is likely to function, and to first offer the 20% of kidneys with the longest potential function to the 20% of candidates who are estimated to have the longest need for a transplant. There are other proposed changes intended to help candidates who have biological disadvantages in getting offers, such as rare blood types or high immune sensitivity. The way kidneys are matched will not change for many candidates under this proposal. proposal, most people who would see potential changes would see benefits in terms of better long-term kidney function or a possible shorter waiting time for a transplant. I would emphasize that this is another opportunity for you to be involved in our policy-making process. This is a proposal. It's not a final policy. And I understand that Jim has already made some announcements about that to you, and we encourage you to get involved, read through that, and make your comments and thoughts known to us. At the beginning, I mentioned the experiences we've shared over the last 25 years. As it's happened, this is also my 25th year at UNOS, so I've had some personal reflections recently. I believe that transplantation is often a series of contrasts. With every organ donation, there is sacrifice. For deceased donor families, there is loss and grief. For living donors, there is a conscious decision to risk life and health. But there is also the transformation, the joy, the hope that comes from the gift of life to the recipient. And there is gratitude and honor beyond any words we can express for the selfless devotion of donors and donor families. Our work at UNOS is also a study in contrast. I'm amazed and humbled by the difference transplantation has made in so many lives. I'm proud of the role we play in making that happen. It's gratifying to know that the work we do every day brings people a new chance to live and be healthy. But there's so much more to be done. For all the people who have been helped, many more remain in need. Some never received that opportunity. We know we can do more and better to help those in need. We can make the transplant experience better for recipients both now and in the future. So the pride we feel is mixed with a constant urge to improve, to respond to new and emerging challenges. At the end of the day, what UNOS does every day is for the benefit of all of you in this room. Thank you for your continued involvement and in the interest of your fellow recipients and family members, and for those who continue to wait for transplant. We've all come a very long way today. We continue to face many challenges, but we are building, planning to meet these needs. I hope you will continue to share with us your experiences and your thoughts, your strength, and your hope for the future. Together we can continue to improve and build our national transplant system for the challenges of today and those of the future. Thank you.
Yeah.
Walter celebrated his 25 years with UNOS this May, but 25 is special this year.
Yeah.